Okay, we're going to finish up with the strengths of person-centered therapy. Again, the client is willing to be open and not being judged, but being able to be listened to. They are empowered and promoted through person-centered therapy and understand that it's their responsibility to make decisions. Some of the weaknesses with person-centered therapy is that it may lead to the therapist being supportive rather than challenging. It also leads away from allowing clients to find their way. Also, some of the weaknesses may be that the therapists are non-directive and passive, and person-centered could be ineffective. Also, there is some limited overall understanding of clients due to lack of use with development, psychodynamic, and behavioral therapies. The inappropriate for those not motivated for change and those with significant mental health concerns. So in looking at that, we have noted that individuals that would best benefit from person-centered therapy would be individuals that are somewhat able to be self-sufficient and not suffer from some severe mental disabilities or developmental disabilities that would prevent them from utilizing the person-centered therapy concept. Briefly, I'm going to show a video that shows you the application of the person-centered process and what it looks like in the application piece between the engagement of the client and the therapist.
Understand that you have some concerns that you'd like to discuss today. So whenever you're ready, I'm happy for you to voice whatever it is that you'd like to talk about.
Yeah, well, I suppose the bottom line is I'm having some difficulties in my relationship with my wife, and I'm very uncertain about actually being here, and it's a bit embarrassing talking about these things with a stranger.
Yeah, so you're feeling a little bit uncomfortable discussing such personal information with an outsider?
Yes, it is. I'm a bit awkward.
Right.
I was brought up to solve your problems yourself.
Yeah.
And you don't go outside the family, you don't take your problems to strangers. And I would normally do, but also I realise now that given the depth of the problem, that I also need to get another perspective on things.
Okay, all right. I guess what I generally say to people when they first come along is that it's not uncommon to feel quite uncomfortable talking to an outsider about such personal information, and even though I can't predict exactly how you're going to feel and how things will go for you today, I do know that in the past a lot of other people have actually felt quite uncomfortable to begin with, but as they've been able to talk and get things off their chest, they actually feel quite relieved. So you might find that as we spend more time together, that you're more comfortable in this environment too.
Well, I hope it works out that way.
Yeah, we'll see how we go.
Well, there was a friend of mine who'd been involved in counselling previously,
Right.
who suggested that this is what I should attempt to do anyway.
Right. Okay. And you were saying before as well that normally you like to solve things yourself and work things out yourself, and I think it's quite a balanced perspective to be looking at how you're going to resolve things yourself, and also to get an outside perspective as well. So I can see lots of benefit that can come from that dual approach.
Well, I haven't succeeded in doing it by myself, so
yeah,
it's worth a go.
Yeah, so perhaps we can shed some light on some helpful approaches for you. Yeah. Okay. I guess to help me understand your situation, it'd be helpful if you could talk a little bit about what's been going on for you and what's brought you along.
Well, I suppose things have just deteriorated in my relationship with my wife, Angelina. We've been married 11 years now. We've got 2 kiddies. Johnny's 9 and Jackie is 7.
Right.
And she's very busy in her job, and she's always been I suppose a bit of a control freak.
Right.
She likes things to be just so. And occasionally she would what I would call it, lose the plot, and she'd yell at me and abuse me. But in the past, that was never a problem because we could sit down and talk about it, and she'd recognise that she'd probably gone over the top and whatever. But lately, it's really just gotten out of hand, and she's not controlling her anger or temper, and it really concerns me now because I think it's starting to affect the kids.
Right, okay. So it sounds like to begin with she might often become quite angry, but she would settle down and you could resolve things, but of late it's become a lot more volatile, and she's become more explosive, and you're really concerned about the impact on yourself and the children.
Yeah, I mean the kids are young, and I mean John, he's a boy and he seems to be handling things okay. But you're always uncertain as to really how things are affecting him. Jackie's only 7, as I said, and she's a lot more sensitive, and she's not really handling things too well at all. And that's really starting to put a lot of extra concern to me.
Yeah, okay. So it sounds like you've got a lot of concerns about both the kids, and John's probably handling it okay outwardly, even though obviously he's feeling it. But Jackie, you're particularly concerned about her. She's quite delicate, and you're worried about that impact.
Yeah.
And all of you are walking around on eggshells at the moment, just waiting for some kind of explosion to happen. Does that sound right?
Well, I'm concerned about the kids, but I'm concerned about the marriage. It's important to me to do what you can to keep things together because that's better for the kids.
Yeah.
But if I had to single out one major concern, it would be probably for Jackie.
Okay.
Because there's been a few incidents lately where the kids have been exposed.
Alright, so next we're just going to take a look at a activity that kind of further incorporates person-centered therapy into practice and some of the things that you can do. Each of you will actually have a copy of this handout in front of you that you can utilize and look along, and these are just some ways that you can pull some things out when you're in session, looking at what are some things that are looming or troubling in your life when you're talking with your clients, having them to write within the cloud some things that are troubling them. Then next, if they could come down into the raindrops and talk a little bit about some smaller obstacles, different things, 3 different things, and include those things in the raindrops. And then next, looking at the lightning, what's that your ability to hold on to the umbrella? And inside the umbrella, what protects you from your small obstacles and what holds the umbrella up. So when you're able to put these things together, and these are just one of many activities that can be used in conjunction with person-centered therapy to show the client that they are somehow in control and allow them to be a part of their own treatment planning and crisis planning. And finally, just some takeaway points from today's presentation. At this time, you should now have a better understanding of the history, key concepts, technique, application, and processing of person-centered therapy. You are now able to compare and contrast the strengths and weaknesses of person-centered therapy, and you have learned skills, techniques, and applications, and take home handouts that you can utilize later on in practice, at your current jobs, locations, wherever you may be, to incorporate person-centered therapy. Thank you.